You know what a Brazilian butt lift is, and maybe you think you have to fill up a few of these canisters to have enough fat to be able to have a BBL. But did you know that you can actually get one with a lot less fat? So how is a Skinny BBL different? Well, a Skinny BBL is the same as your standard Brazilian butt lift, but more subtle. You might be thinking of a regular Brazilian butt lift as maybe 2014 Kim Kardashian, right? The full diaper look, but a Skinny BBL is more subtle. And the reason for that is that there's less fat for us to transfer. This procedure tends to fill in the hip dips to add more curves to the waistline, but can also add some projection to the backside. So the end result is that you get a little bit more curvy rather than looking like you've had a giant bubble butt added to your backside. So who's a good candidate for a Skinny BBL? The ideal patient for a Skinny BBL has a lower BMI, typically in the range of 22 to 25, and have some pockets of fat that just won't go away with diet and exercise. Other factors that make you a good candidate for a Skinny Brazilian butt lift are being in good overall health, non-smoker, and can spend a few weeks not sitting directly on your butt post-op. Is the surgery any different than a regular BBL? Well, a Skinny BBL can be slightly different than a regular Brazilian butt lift in the way that we obtain the fat and where we get it from. We have to be careful how much fat we take in certain places. The reason being is that we are trying to balance the amount of fat that we're trying to take for the transfer itself with the overall end result in the areas that are liposuction. Areas that already don't have a lot of fat can be at higher risk for contour irregularities if it's overdone. The other difference is that we may need to lipo more areas to get a usable amount of fat to transfer. For example, a person with a higher BMI getting a BBL may be able to have the abdomen, upper and lower back liposuction to get a good result for their BBL. But in a Skinny BBL, we may need to do all those areas plus the arms and even the thighs in order to get enough fat for the transfer. Also, we may need to do more sculpting of the lower back and flanks to help carve out the area just above the butt, so that way we can get better curvature of the lower back, which can then in turn add more appearance to the projection of the butt itself. After we have the full amount of fat that we need for the transfer, then the fat is processed and transferred in a similar manner to a regular Brazilian butt lift. But the areas that we transfer the fat to can be a little different. If we are trying to get you more curves, a good amount will go towards filling in the hip dips, with the rest being used to add projection. But remember, the sculpting of the lower back is going to do a lot of the work in giving us the appearance of more projection. And again, these results in a Skinny BBL are for the most part subtle. You're never going to achieve a Cardi B or a 2014 Kim Kardashian butt with a Skinny BBL. Unless you get butt implants, but that's another topic in itself. But what about recovery? Well, the recovery for a Skinny BBL is the same as that of a regular BBL. And if you want to learn more about that, then you can watch this video right here. I'm Dr. Paul Pearce, and I hope you learned something today. We'll see you in the next one.